International Epilepsy Day, that is celebrated every second Monday of the February. This year it was celebrated on 14th of February 2022. The theme for International Epilepsy Day was 50 million steps. This day is celebrated to create awareness about epilepsy, and National Epilepsy Day, that is celebrated on 17th of November. Epilepsy is a condition which is characterized by repetitive seizures. Now the question is, what is seizure? Seizure occurs when there is excessive and abnormal electrical activity in the brain, and symptoms of seizures are, if the abnormal and excessive activity occurs in the entire brain, there would be grunting sound, stiffening of the body, jerking of the limbs, followed by loss of consciousness, and the seizure would last for a minute or two maximum. After that you regain consciousness, but you are little confused for 10-15 minutes, and this is known as generalized tonic-clonic seizures. But sometimes there is abnormal or bizarre behavior, that is also a manifestation of seizure. This is known as complex partial seizures. And when the abnormal electrical activity occurs only in part of the brain, there could be just jerking of one limb or one upper limb or lower limb. This is known as partial seizures. Sometimes there could be just transient numbness or transient tingling sensation. That could also be a manifestation of seizures. So all this could be seizures, and especially in school children, sometimes there is transient lapse of awareness, like they are attending the classes and temporarily for 1 or 2 seconds they lose contact with the external environment, which is known as absent seizures. So all these could be seizures, and when there are repetitive seizures, this is known as epilepsy. Epilepsy per se is not dangerous, because seizure, when it occurs, it subsides within 1 or 2 minutes, but sometimes there is risk to life because of epilepsy. There is a condition which is known as SUDEP, which is sudden unexplained death in epilepsy, which occurs in roughly 1.6% of the people per 1,000 people suffering from the epilepsy. Apart from this, epilepsy increases the risk of accident. Suppose you are standing at a height, you may fall down. If you are near water or swimming pool, there is a risk of drowning. If you are near fire, then you can just fall into that fire, because during seizure or epilepsy you are totally cut off from the external environment. So that ways it is risky or dangerous. So it's always advised that those patients who have epilepsy should refrain from driving. Epilepsy can occur at any age. It can start in early age, but there are different causes as per the age: early age, middle age or late age. In all ages the causes are different, but it can affect all age groups. Type of epilepsy, we can broadly categorize the epilepsy into primary generalized epilepsy and secondary generalized epilepsy. Primary generalized epilepsy, when the structure of the brain is normal, but there are some chemical changes because of which you have seizures. In secondary generalized seizure, there are structural problem in the brain that can occur because of various reasons, because of some inflammation, because of the brain trauma, or because of the surgery. If there is a scarring or any problem in the brain, that leads to abnormal brain tissue, and there is a short circuit from that area, and that leads to seizures or epilepsy.